Some state lawmakers are looking for support now to create a public umbilical cord blood bank right here in Connecticut.
Right now, if parents in Connecticut want to store their child's umbilical cord blood, they have to pay private banks. News 8 health reporter Jocelyn Menta tells us a public bank would be free of charge.
Darren and Sonia, we are talking about cord blood, the blood left in the baby's umbilical cord after it is cut. It is a rich source of unique stem cells for potential medical use, from leukemia to sickle cell disease. Now, legislators are looking into creating the first public cord blood bank in the state that could save the life of a loved one. This is the only umbilical cord blood bank in the state, but it is private, meaning donor families pay a costly fee to access the cord blood for their own use.
If you have an individual that wants to store the blood that's certainly their right to be able to do it, but think about its immediate likely uses. If the child develops leukemia, it's from the cells that you just banked. You're not going to use those cells.
Healthcare specialists supporting legislators in Hartford proposing legislation for the first public cord blood bank in Connecticut.
It's not guaranteed that you're going to get to use it, but you're helping other people. And you might get that help in return if somebody's donated blood. It's about people helping people.
In fact, doctors say there is a 1 in 20,000 chance in needing it. But the unique stem cells in a baby's cord blood, usually thrown out at birth, is vital to a number of medical treatments.
People in Connecticut who need transplants would have access to cord blood provided by people from all over the country who have also given their blood to a public bank in that area. So
that's because the public cord blood bank would be part of a national registry, which also impacts the cost. Instead of millions, it's down to an initial cost of $200,000. There are patients who've benefited from the advances of stem cell research. State Representative Larry Miller used his own stem cells in his fight against multiple myeloma.
I had a 5-year death sentence, and now it's 13 years, so it's every year is a bonus year for me. You know, there's no cure for the cancer.
Legislators want to hear from you about the proposed public cord blood bank. A public hearing is set for tomorrow starting at 10 a.m. before the Public Health Committee at the Legislative Office Building. Darren and Sonia?